Today we have with us a very special guest, an accomplished orthopedic expert who has come all the way from the UK, Dr. Kumar Kaushik Das. With years of expertise, Dr. Das has been transforming many lives. It's a humble request. As this interview will be going on in English, please do not write any hate comments on the video. So let's start this interview. There is no need of welcoming you as this is your country, your soil. I just wanted to know, I had a query actually. You just have taken a very long flight from the UK to India. So I wanted to know, did a doctor like you ended up getting the little back pain during the flight?
No, I'm not sure why. I did get back pain when I was preparing for my FRCS exam. Um, I suppose pain is half of what it is and half of what we imagine it to be. Our brain is a very powerful organ. Um, at some point, you have to realize that not every pain needs worrying, and then sometimes the pain stops happening. Um, I mentioned about my exams because when you are under stress, sometimes your body processes stimulus differently. So if you're sitting for a long time, yes, it will feel uncomfortable. But when I am under stress, my brain processes discomfort as pain. But when I am going for a trip to India, my brain processes discomfort just as discomfort. So I think we have a tendency to sometimes use our anxious brain and make things more worse than what they actually are. And I think this is where having a good social circle, good friends, having a positive outlook to life will make sure that we have less pain and occasional discomfort.
Sir, for me, I personally think orthopedic is not just about bone and joint, it's about restoring confidence. So, how do you see this field? What is this field actually? What is orthopedics?
Well, the name orthopedics is designed from a way of making a tree straight. If you look at the symbol of orthopedics, it has a bent tree and a support system to make that tree straight. And it was designed because initially orthopedics was used to treat children who were growing and they had some deformities. And now it has expanded to every bone and every ligament. But I see orthopedics exactly as that. I am there to enable my patients to achieve what they want to achieve. I am just a facilitator. There is a famous quote in medicine that doctors amuse patients while the body heals itself. So that's why I don't want my relationship with my patients to be a patriarchal relationship where the patient comes to me saying, "You are the God and you fix me." I'm just there to show them the right way. Sometimes that is advice, sometimes that is medicine, and sometimes that is surgery. So I'm just facilitating them and enabling them to achieve what they want to do. And everybody might want to do different things. I have a 70-year-old patient who just wants to reach the top cupboard to get the cookies out to have a tea. I have a 20-year-old patient who wants to play rugby and football. So I'm just there to facilitate, and that's what I do in orthopedics.
AI is there, robots are there. How do you see what do you think, what is the future of orthopedics, especially in India?
So, first of all, India is doing very well in adopting new technologies. I have seen many of the hospitals already having robots. The AI will have more benefit in diagnostics, where we can look at the images and scans quickly because human beings can make errors. So, we have a discussion commonly in our orthopedic meetings. What is the most common fracture that you miss in a patient? And the answer is a second fracture, because as soon as you see one fracture, you say you have got the diagnosis and you treat that, but you miss something else. And this is where AI might be useful, because as a rigorous computer, it will keep looking for all the problems that are wrong. At the end of the day, it is still a decision between a doctor and patient whether that problem needs treating. If I go and scan everybody in Bhubaneswar, loads of patients will have slip discs and disc degeneration and arthritis. Doesn't mean everybody needs a surgery. So I think that role will still remain with the doctor and patient, but AI will definitely have a role in avoiding missing things. Now, with regard to robots, the robots will just assist you. It is still a robotic assisted orthopedics and the surgeons doing the operation. We will be very good from a robot to know how much is the deformity, what angle, what deviation, how much millimeters. But how much of that to accept and how much of that to change is still a decision that's based on your judgment. So when we do robotic surgery, we talk about the hierarchy of compromises. You can't get every human body to be a straight line. Everybody is born differently. So the robots will give you the information. There are some compromises you accept and some you don't. And that is where I feel every doctor should be trained how to operate without a robot and with a robot, because the day if the robot fails, you still be able to do the operation. And that's how the training of my training has been, that I have done them without robot and with robot, so I can do it both ways. So when patients come to me asking, will robotics guarantee the success of my surgery, I say it will help. It's a helpful tool, but the best result still depends on me doing a good operation, not causing any intraoperative complications, and equally on you as a patient to exercise, to follow the guidelines, and keep yourself motivated and getting the best outcome. So it's a mutual partnership between me and my patient to get the best outcome, and the robot is just there to help.
So, is there any concept or idea in the Indian orthopedic idea that you want to borrow from here, or is there anything from the UK you want to bring here?
So I really like how efficient we are in India, our can-do attitude. So whenever I worked in Mumbai, I have also visited hospitals in Coimbatore. We get things done, um, and sometimes that means pushing ourselves beyond limit, and sometimes that means doing things for patient, going out of our way. So I think that culture of hustle, getting our things done, is something good that the West can learn from India. Whether it's when it's about learning things from West to India, I think it's more about safety and communication. So we were discussing earlier in the interview about a national joint registry. Whenever we have any complications or never events, we discuss that openly. We have a duty of candor where doctors go and tell patients what has gone wrong. And we have a national indemnity system where patients are compensated for it, for any complications. So as doctors, we feel comfortable going and sharing things. We also talked about the medical examiner system where every death is investigated and any learnings that can be made from that to prevent future complication is shared. So I think in that way, the culture of safety, transparency, and communication is something India can learn. We're already doing it. The culture is improving, but it's still something we can still carry on making better.
So, one last question for you. In India, here we feel every season. We feel summer, we feel winter, and here monsoon. We also feel. But in the UK, it feels like the cold has signed a permanent residency there. Is the permanent cold has any impact on your bone, or just Indians are just little bit dramatic?
I'm not going to answer whether Indians are dramatic or not. I will avoid that question. But to answer the question about the weather, um, whenever there is cold weather, there is definitely some association with joint pain. Um, some people talk about the barometric pressure of air and many things. But like we said, whether you call it pain or discomfort, it depends on your outlook towards life. Going back to health impact of cold weather, there is definitely an impact from a vitamin D point of view. And if you go back and look at evolution, when human beings migrated from Africa to European countries, the fair skin was an evolutionary change because they didn't get enough vitamin D with the dark skin. And vitamin D not only helps your bone, there are research coming out, it also helps your cardiac health. And during COVID, people who are vitamin D deficient also had poor outcome. So yes, being in a colder weather, you're likely to get vitamin D deficiency, which can affect your bone. At the same time, some of my friends who are working in India in corporate offices, although they are living in India, they never get to see the sun, so they become vitamin D deficient as well. So we have to be careful when we compare data from one country to another that all the parameters are same. With regards to weather, yes, in winter we see a slightly more number of cold and flu and those cases needing more hospital admission. At the same time, we see less frequent infections from other things because of the cold weather. Insects and tropical diseases and mosquitoes are less in UK. So you can never have a perfect country to live, but you can have a perfect attitude to look at things glass half full, not empty.
Very well said, sir. Thank you so much for making us all proud. Thank you for sparing your time and wisdom. Thanks a lot. Thank you.